I will pass it off to our student moderator, our lead moderator, Charlotte. We'll take it from here. Thanks so much, Charlotte.
Thank you, Cassie. As Cassie mentioned, thank you all again for being here for this great alumni program. My name is Charlotte, and I'll be moderating the conversation today with Lizzie, who's the assistant moderator. Lizzie, would you like to quickly introduce yourself?
Yes. Hello, everyone. My name is Lizzie. I am a junior at Northwestern, and I study global health and neuroscience.
Thank you, Lizzie. A little bit about myself too. I'm a junior studying social policy and global health studies major and minoring in data science. So before getting started, I want to share some more information about the program in global health studies because all of our alumni speakers minored in global health studies while they were students here at Northwestern. So Global Health Studies was initiated in 2004 as a minor, and this program in Global Health Studies was one of the first undergraduate programs of its kind, and it's now widely recognized as a national leader in its field. GHS was the first Northwestern undergraduate curriculum to require an international experience, and prior to COVID, 100% of the students studied and conducted research abroad. In the fall of 2017, the program expanded to include 2 new offerings, the adjunct major in GHS, which I am currently part of as well, and a combined 5-year BA/MPH program. Student interest and enthusiasm for the GHS program continues to grow, and GHS is now currently one of the largest undergraduate programs in the college. While a large proportion of GHS graduates, about half of them, pursue advanced training in medicine and the health sciences, and they become doctors and public health practitioners, the program attracts students from all of NU's undergraduate colleges spanning a wide range of interest, from economics to anthropology to social policy and engineering. If you're interested in learning more about the program, please feel free to send Cassie a chat, and she will put you in touch with Greg at the program in Global Health Studies. Okay, so now without further ado, we'll have a great lineup of alumni speakers to share the insights of the group today. Once we hear from them for about 40 or so minutes, we would take questions from the audience. So feel free to think of questions while you're listening as well. If you want to turn your mic on to ask a question, please submit your question via the public chat tab and we'll call on you. If you'd like us to read the question out to our panelists, please send Lizzie a private chat. So if you want to read out, send it to public chat. If you want us to read for you, send it to Lizzie. So without further ado, we'll start with introductions. Can we start with Perry, please?
Absolutely. Thanks so much, Charlotte, and glad to be here with all of you. My name is Perry Cason. I was a student from Northwestern graduating in 2011. I studied sociology and global health studies as a minor. If there wasn't even a major yet when I was a student, and I didn't know about the 5-year MPH program. So lots of cool things coming in the works since we've graduated. I currently work as a consultant at the Infectious Disease Bureau at Boston Public Health Commission, which is our local health department here in the city. I primarily work on COVID outbreak investigation and COVID epidemiology. I'm new to the Boston Public Health Commission. I was with Partners in Health doing that same outbreak investigation work for the past 1.5 years. So thank you so much for having me, and I'll pass it off to Tej.
Hey everyone, my name is Tej Maltiwala. I'm really happy to be here with you. I graduated in 2012. I was a bio major and global health minor. I studied abroad in Paris as part of the minor, which we can talk about more, but was really awesome experience and really informed kind of a lot of my career path, actually. I currently work in population health strategy at Oak Street Health, which is based in Chicago. I actually, as it relates to the pandemic, I led our telehealth program in 2020, and my work now really centers around patients who are kind of transitioning across different sites of care. So I work on Oak Street's transitional care program. Anyway, really excited to be here.
Thank you, Tej. Can we now have Jackie introduce herself? Thank you.
Hi, everyone. I'm Jackie Korpix. I graduated in 2009. I was a psychology major and a global health minor because we didn't have the global health major at that time. I studied abroad in Mexico City as part of that minor, which was a great experience. And then after I graduated, I went to medical school. I'm also a board certified pediatrician, and then pursued additional public health training through a preventive medicine fellowship where I got my MPH at Northwestern and graduated in 2020. I'm currently working at the Cook County Department of Public Health as the medical director for the COVID-19 response. And I'm primarily focused on COVID-19 vaccination. And thank you for having me.
We're glad to have you too. So for the first question, maybe we can start with Jackie, and then we'll go with Tage and then Perry. Can you share with us some of the impactful classes or experiences for you in undergrad that led you to pursue a minor in global health studies? And how did your minor impact your path to where you are today?
Thanks. Yeah, so my interest in global health was sparked in high school. I saw Paul Farmer speak, and so I was excited to learn about the opportunity available at Northwestern to do the global health minor. And so I still remember and think about many of the classes I had there. And even, those things apply even to this current day. And then same as Tage, my experience abroad was very influential and did inform my work, kind of solidified that I wanted to go to medical school, and then continue working in doing global health in some way. I did a few different global health trips as a physician, and then eventually was happy to find my way into public health, and so that's where my focus is today.
Thank you. Yeah, global health and public health is very interlinked, definitely. Can we have Tage, please? Thank you.
Similar, yeah, I mentioned this in my intro and Jackie mentioned it as well. I think my study abroad experience was definitely probably the most impactful part of the minor. I'm hopeful that is or will again become part of kind of the experience that everyone has at Northwestern in the program now. For me, my path has been a little bit different in that I was pre-med at Northwestern. I had the intention of becoming a physician administrator over time, and also just kind of had an interest in health systems and health policy. And I learned a lot in Paris about kind of how different health systems are structured and financed and what that means for care delivery and what it also means just for kind of health equity as well. And I found that to be really interesting, and that motivated me to get my MPH. So I forgot to mention this in my intro, but right after graduating from Northwestern, I got my MPH at Columbia, and I studied health policy and management there. And I think that my time abroad was definitely kind of the most influential piece of that decision, because it really opened my eyes to how much impact can be had when you work sort of both at the macro level of kind of what the system looks like, as well as at the micro level of like actually delivering care to patients, as a provider or medical professional. So yeah, I think that my experience abroad is probably most impactful. And I kind of wish that I had figured out some stuff earlier at Northwestern, because I think there's probably like other classes that I would have taken looking back, whether it be like in social policy or economics or other things. I felt like I was so focused on being pre-med that I wish I had a broader aperture kind of earlier on. And I think that's, a key learning, at least, that I can hope to share with current students. Even if you are pre-med, like being at Northwestern is an awesome opportunity to really broaden your horizons and make sure that you're tapping into all that's available to you.
Thank you, Tage. Yeah, that's a very good advice on venturing out to different majors and departments. Can we have Perry, please?
Yeah, absolutely. I definitely have bits and pieces from what Jackie and Tage just shared that resonate with me. I also started as pre-med. I was a chem major coming into Northwestern, and quickly realized that actually wasn't my dream, that I was floating out to the dream of being a doctor, which we love individualized medicine, but there's different ways to impact health and healthcare and well-being. And so I ended up I didn't even know that population health, public health, or thinking about things at that level was an option. I'm from the South. That wasn't a talk of community care in that way growing up. And so I definitely realized that was an option and pathway for me at Northwestern. Hence the pivot toward sociology, thinking about social determinants of health, thinking about broader systems that impact individual choices, opportunity, and what that means for health outcomes and well-being. Like Jackie and Tej, I also studied abroad, and that was really, really critical to me. I did the program in South Africa, outside Cape Town, and that was really illuminating as a white Western woman entering the global health space. What does it mean to work in other countries, other cultural settings with different norms about health and well-being? So that was an illuminating and humbling experience. I also was a part of Globe Med when I was at Northwestern. And I know Globe Med, at least when we did it, the partner site was in Ho, Ghana. And that was really, really a good way to get my hands dirty, understand sort of what it means to support global health at that level. So definitely would rec Globe Med if that is still up and running on campus.
Yeah, thank you for sharing that personal reflection. And I can confirm that GlobeMed is still up and running and working with an Adonai Center. So the next question that we have is, what was your first job out of undergrad and how did that impact your career path? Maybe we'll go backward and start with Perry this time.
Yeah, definitely. So my first jobs out of undergrad, I moved to New York and I worked on the global health team at Clinton Global Initiative, which was no longer, but was a part of the Clinton Foundation. And that was really helpful in getting a sort of 50,000 foot view of all global health activity and sort of the major players in terms of funders, practitioners, leading experts and researchers. And so that was a good crash course, but also quickly taught me that I had some public health skill sets that I wanted to deepen. And so like Tej, I went back and got my MPH quickly after just a year out of undergrad. So I got my MPH from Yale in 2014, also in health policy and management. So the job was helpful to sort of build and get me understanding where I wanted to focus more within the public health field.
Thank you. Paige?
Yeah, I think actually my first experience that we post grad was an internship. Actually, the summer after my senior year was at GBC Health in New York. They work with private sector companies on their corporate social responsibility and making investments in global and public health initiatives. And it's actually interesting. I think the experience that I got there was actually working more on the corporate side of GBC Health, thinking about what their business model looks like and how they can best serve their clients. And I think that experience actually helped me get an internship at Deloitte between my first and second year of my MPH. So I did an internship in management consulting between my first and second year, which is really my first professional experience. And that is really what opened my eyes to the amount of impact that you can have from kind of coming at these issues from a business perspective. And I did have the opportunity to work with both private and public sector clients when I was at Deloitte. But I think that exposure to a broad set of clients with a wide-ranging set of issues related to healthcare really helped me understand where I fit in, while I was also able to build kind of some core business skills that I think I've taken forward into my other professional experiences.
Thank you. Jackie?
Yeah, right after undergrad, I took a year to volunteer and I worked as a patient care technician in an emergency room and used that year to apply to medical school. And so from there, then I went to medical school. In medical school, I definitely had this focus on preventing disease rather than treating acute illness. And that led me to pediatrics. I was between pediatrics and family medicine. And then, but I really just wanted to focus on prevention. And to me, that was like pediatrics, I can, prevent diseases before they ever happen. And then my first job out of residency was just a primary care pediatrician at a federally qualified health center, largely serving immigrant and refugee populations. which I definitely enjoyed, but my, experience, I definitely had this passion to like pursue things at the larger level, because a lot of things I was seeing as a physician with the individual one-on-one visits were so frustrating, because a lot of the problems I was seeing with my patients, really needed this approach at the larger level. And I had always thought about getting a master's in public health. And so I explored different programs. And then I was fortunate to find the preventive medicine program through Cook County Hospital and Northwestern that would basically fund my MPH, but then also give me a more a specific experience to what physicians do in public health. And so I'm very grateful I found that program. I had no idea preventive medicine was even existed as a medical student or resident. And so then after that definitely shaped my career in a lot of ways and led me to working at the health department. And then I largely, right now I'm basically focused on COVID. Before then, my interests largely were in adolescent behavioral health.
Thank you all for sharing your start of your career journey. That is very insightful. I'm sure a lot of students was benefited by hearing that. And the next question that we have is, what are some of the challenges you are facing working in public health or healthcare during the pandemic? I know some of you and the work that you do is related to the pandemic, so this is going to be a very interesting question. And also, were you doing the work you're doing now before March 2020, or was your role directly impacted by the pandemic? Can we start with Jackie?
Yeah, so as I mentioned, as a preventive medicine fellow, I was largely focused on behavioral health, adolescent health, violence prevention. And then January 2020, we had the first case of COVID in Illinois. And so being part of the preventive medicine program, I was pulled to do those investigations with the CDC, and then have pretty much been involved in COVID work ever since. Transitioning to full COVID focused work when I took the position at the health department. So definitely challenging. I mean, public health in the United States is not, valued as much as it needs to be, and just really had an experience of the lack of infrastructure that exists within public health. And the only benefit of COVID has been, shining a bright light on the fact that we've disinvested in public health as a country, and also shining a light on all of the health inequities that exist and health disparities, things that people in public health know. We get used to seeing that map of Chicago where, pretty much every health problem is worse on the south side and on the west side. But I think this, the pandemic has really made a lot more people informed about, things that are happening in terms of health inequities, and also about the importance of public health. So we're definitely seeing more funding coming into public health, which is exciting, but that lack of infrastructure is making things hard to, roll out in a way that makes sense. So, thus we're seeing all these things where we're kind of failing in multiple aspects of the response. And so it's definitely challenging to be a part of that failure, but then also, I feel hopeful given this new focus on public health that, we're able to develop it better as a country again.
Yeah, thank you for highlighting that systemic factor going on. Can we have Tej?
Yeah, so my role was directly impacted. It's interesting. I started at Oak Street actually today is my 2-year anniversary. So I started at Oak Street on February 3rd, 2020, with the intention of sort of working on some special projects for our chief pop health officer. and within a month was asked to really focus on our telehealth strategy and basically pivoting our entire care model from fully in-person clinic-based primary care for about 80,000 patients over to basically 95 to 100% telehealth. And we had, we didn't have a platform, we didn't have processes, we didn't have metrics, it was not a core capability for us. And so my selfishly, my role was directly impacted, but it was also a really great opportunity because I think similar to what Jackie just kind of blew open I don't know what I'm trying to say. We were suddenly exposed to all of these underlying factors that prevent patients or people from being healthy. And I think we always talk about things like the social determinants of health and other factors that can impact people's health status. But I feel like the pandemic really put a magnifying glass on all of that. We found that about half of our patients didn't have smartphones. Of those that had smartphones, only maybe 50 to 75% of them were actually savvy at using their smartphones. There was a real kind of access to care challenge that came up with our patients that are on Medicare, and half of them are dually eligible for Medicaid. So there are seniors and low-income seniors at that. So I think that also to Jackie's point, it really just shows the lack of public health infrastructure that we have. And even as a private entity trying to deliver primary care, we run into a lot of those structural challenges that that really impact people's health and their outcomes. So I'm also hopeful that this can lead to real change. I think all the work that we're doing sort of with individual patients and with small populations hopefully adds up to impact at a greater level. But I think the work that we can do collectively as people who are focused on public health and global health is help make those right investments so that these disparities don't persist, because we need to be prepared. Forgetting the pandemic, on any given day, people have these challenges with housing and internet access and food and all of those things. So kind of seeing that up close and personal for me was really interesting, and playing a role in also helping to address that was really gratifying as well.
Yeah, thank you. Small changes definitely accumulate to greater force. Can we have Carrie?
Yeah, absolutely. So I was not working, this was a large shift when the pandemic happened. I previously worked in health system strengthening. I was doing management consulting and working with either health systems or philanthropic organizations on their social impact strategies. I was focused primarily on behavioral health, but pandemic happened and the need was there. And so I pivoted. I definitely did not intend to become an infectious disease expert, but that is somewhat what has happened. So I saw the need, and Partners in Health had stood up a statewide program for contact tracing in Massachusetts that was really leading the nation on that effort, and was a part of that team and worked with some EPIs as well as some other folks doing that epidemic intelligence and COVID investigation. That was all a new skill set for me to build in the pandemic. And that was sort of the need of public health to pivot, to sort of jump in even when you don't know what you're doing. And I think that's rang true pretty much every day of my work in the pandemic. There's always a new scenario that we haven't planned for. There's new policy that comes down that we weren't aware of. And how do we operationalize that? How do we implement it? How do we communicate it across multiple different languages and really reach all of those users, those families, our community members who are not tracking the news, or they're just not engaged in that way, right? And so I think the pandemic, beyond the actual prevention of transmission and access to treatment issues, we've also seen the challenges of the public health sector around communication, around effective strategy, around coalition building. And I want to highlight those as core skill sets for public health too. It's not just medicine and science. It is, can we talk to each other? Can we understand each other? Can we build relationships? And that's been really critical across local and state partners to work in collaboration, to be aligned and coordinated in our efforts, to know what's going on. lots of challenges still on that front for sure. And we have folks like Jackie at local health departments like leading that effort and trying to coordinate. I'm sure that there's lots of hiccups there, but all of it is moving forward towards more alignment and coordination.
Yeah, thank you so much. Definitely a lot of challenges.
Can I just add
Yeah.
one thing
Yeah, go
to
on.
what Perry mentioned? I think one of the other things that I was exposed to in one of my internships that Perry, what you just said kind of rang a bell for me was like disaster preparedness and readiness, and like that being a core component of effective public health departments and like healthcare organizations. Because I remember when I did an internship, learning more about that, it wasn't something that I was personally interested in, but I think now I like see the importance of having a really clear plan around how you're going to prepare and respond to emergency situations, because a lot of like your framework totally changes, right? Of like when something like this happens, you have to shift sort of at the drop of a hat. And it's much easier to do that when you actually have a real plan in place, particularly around communication and how you leverage different stakeholders and kind of working together to solve problems. I think that's really the other key takeaway that I've had from my experience kind of working through the pandemic is the importance of teamwork and collaboration and communication, especially when you're not in person. It's been definitely like a learning experience. And for me, it was like I was also at a brand new company. So I think that kind of added to the challenges and something that we should all be kind of prepared for in future scenarios.
Yes, there's a lot of collaboration going on, and global health studies is also a very interdisciplinary major. I've seen so many different people in there, and that's the collaboration piece really do come in. So we'll see Perry in a bit. The next question that we have is, what has surprised you about what you learned or did in school, or what you did in school that helps you in your work today? And how does your arts and science background play out in your work today? How about we start with Taish for this question? Thank you.
Yeah, I think I mentioned this a little bit earlier, but I actually think that I wish I had taken more full advantage of being kind of a liberal arts program and having the opportunity to explore more. As I mentioned, I was really focused on applying to medical school and honestly like working on my science GPA and things like that. And in retrospect, it feels like it was a missed opportunity for me to really kind of spread my wings a bit more. Like I actually took a bunch of religious studies classes because it was something that was interesting to me. I grew up in a Hindu family that wasn't like super religious, more like cultural. And I was like one class away from being a religious studies minor. So that's just one example. But I think it's being in college in a liberal arts program, you really have a great opportunity to understand more about other people, about things that you don't know about. I think that aligns really well with being a global health studies minor or major as well, is just making sure that you have a broad understanding of all of the different aspects that feed into health and public policy and things like that, because that will kind of help you be a better leader over time. I think, I was lucky enough to be able to build some core business skills, as I mentioned, through my consulting experience, which I really value, but I do think that I could have probably gotten some of that experience even earlier on if I had not been so like laser focused in college. So I don't know, that's kind of my take on my college experience. I think there was a lot of value that I got out of the global health minor for sure, but yeah, I wish I explored a little bit more.
Thank you for that reflection and that advice. Can we have Jackie, please?
Yeah, I think the great thing about public health, but the challenging thing is that it really, takes a variety of skill sets. And like with my colleagues that I work with, I think like some of us are strong in some areas and weaker in other areas. But definitely having like I totally agree that having like a broad different experiences in undergrad is super helpful. Like classes I think back to, to this day that still apply are like my psychology classes definitely apply, my sociology classes, bioethics, knowing the history of science and medicine was a class that I still, think back to this day, and that definitely, really informs a lot of our work. It would have been helpful also to take, policy classes, business classes. Right now I struggle, like working on budgets and things like that within public health that, I didn't really get in undergrad or medical school or my MPH, but really, I totally agree that having that broad experience as an undergrad is something to definitely take advantage of.
Yeah, thank you for sharing that. And that points to how like interdisciplinary, multidisciplinary public health is as a field. The next question that we have is, can you tell us about a time when you made a pivot in your career or a time when you had to explore your career options again after you graduated? I think both speakers touched a little bit on that, so maybe you could expand a bit on that, up to you how you want to do it. Yeah, thank you. Can we have Jackie, please?
Yeah, like you said, I touched on that. In undergrad, I was between going into psychology or going into medicine. I didn't really know of like public health as a career option. It definitely had the interest, but just wasn't, didn't really understand how that all worked, both going through public health as a non-physician or a physician. So definitely, I think like looking back, I wish that I had more value on networking, because I think I did not see the value of that prior. And so, but then as I've grown in my career, that, seeing people and the different things that they're doing within public health, helps inform you and what you want to do. So like even being able to identify, oh, that person does something that I find really interesting. Let me talk to them and figure out what they did to get to where they are now. And even to this day, I'm continuing to meet people that are doing different things that I find interesting. And I'm learning that a lot of people in public health are kind of like, don't always stay with one thing. They kind of transition between, maybe local health department, working at the state or national level, working in academics. So I just wanted to mention that. But the big like career pivot I had was when, I was in this medicine track and not really exposed very much to, getting, doing your residency and then finding a job. And so it was my first year out as a primary care pediatrician that I was like, I like this, but it's not what I want to do forever. I'm frustrated with the way that the system functions as a physician. I'm, only year one in my job, and I can already see myself burning out very quickly. So like that was when I had to say, okay, I need to I can continue to do this at an individual level, but I also need to be approaching it at the larger level or I'm going to burn out very quickly. And so that was like my pivot into getting more training in public health and then making a career out of that.
Yeah, and you touched a little bit on networking. That would be our next question. So hold that thought. Can we have Tej share a bit about the pivoting?
Yeah, so I think I referenced this a little bit. I think there are probably two major pivots that I made. One was like about going to medical school. So I applied to medical school while I was in my MPH program at the same time that I was doing my internship at Deloitte and was trying to figure out, okay, I've always been thinking that I'm going to go to med school and become a physician administrator. I'm going to keep pushing this ball forward, but I'm also going to try this internship, see how I like it. I ended up liking my internship experience because it was the first time I saw what it's like to be in a health insurance company. So I was at Humana helping them think through their provider IT strategy, and it just showed me like how big of a role health insurance in this country plays in terms of how care gets delivered and financed, et cetera. And I also saw like the good faith efforts that they were making to really improve the provider experience and patient experience as well, which was totally different than sort of how I viewed health insurance going into it. So because of that, I decided to defer my admission to med school, try consulting for a bit, kind of went back and forth for a year and a half, almost maybe 2 years, and then ended up declining my spot in med school because I realized that I felt like I was already having an impact at the level that I wanted to, and I just didn't have the same motivation anymore to pursue the clinical path. I mean, I'm still early in my career where maybe 10 years from now, I might regret not having an MD next to my name in terms of like the level of impact that I can have, because I do think that physician leaders, we need more physician leaders in working in healthcare and people who can bridge the clinical and business objectives in a really cohesive way. It sounds like some of what Jackie's doing. So we'll see. I think that I made the decision that I felt was right for me in the moment. And, you know, I may come back to it later in life saying what if, but I feel like that was a big pivot for me. And so far, so good. The other one that I think was important was from consulting into kind of a real life atmosphere. Because I think that while consulting gave me those core skills that have been really helpful, I really wanted to work at a mission-driven company. So both of the places that I've worked since consulting have been, though privately owned and publicly traded, or rather publicly traded companies, like they're not for profits for sure, but both are focused on high risk, high need populations like Medicare, Medicaid patients who have otherwise had limited access to healthcare and have really had poor experiences with the healthcare system. And to me, it's really important that like the work that I do helps bring better care to communities that need it. I think that while it's not public health in like sort of the typical sense of the word, I think that the work that we are doing is advancing goals related to public health, primarily around access, quality, and improved health outcomes sort of at a population level. So yeah, I mean, I think the two major pivots were around med school and then consulting to a real care delivery organization. And I think it's all about figuring out what your interests are and like what motivates you. And not everyone is like, what I've learned is like, not everyone is mission driven necessarily. Like some people like want to go to work and like be done and then have other parts of their life. And I'm working on my hobbies so that I work less. But I think you have to figure out what motivates you and what kind of balance you're trying to strike. And I think that really needs to guide decision-making around what job or career is right for you. And that can be different at different points in your career as well. So I think it's really kind of a dynamic thing that you got to kind of take as it comes.
Yeah, thanks for highlighting like how there's so many different paths that you can serve and contribute in public health, like identifying your personal role in that. And that kind of ties into networking, because I'm guessing that's one of the ways that you find out your interests and your positioning. So what advice do you have for networking within your industry? Can we start with Tej?
Yeah, so I've been told that I network well, but I don't pay that much attention to it. But I think it is really important because ultimately, like, healthcare is a really small world. I work in value-based healthcare, which is an even smaller world, and building organic relationships with people who are doing similar types of work not only helps you like get better at your own job, but also maybe opens the door to future opportunities over time. So there are folks who I have actually a Northwestern alum, a great example. I reached out to a guy who was in my class at Northwestern, and he was working at a telepsychiatry startup in New York. I didn't even I didn't know him. We had never met before, even though we were the same year. Shot him a LinkedIn message because we were doing similar work and just wanted to connect about different opportunities. And now he's someone that I talk to every 6 months about like where we are in our career journeys. He like interviewed at Oak Street, like we've had different conversations over time. So I think having those like real conversations with people about your work, your motivations, your goals, I think is really helpful. And you just have to like kind of carve out time to do that. And I really feel strongly that like you should do it in an authentic way. Like I think that there are people that I've come across where like I feel like they are networking with me, and I don't respond well to that because it feels like a little disingenuous. And so I think it's important to strike the right balance of like being a real person while also advancing some of your other interests, you know, or goals of what you want to get out of the conversation versus being too, I guess, maybe too obvious or too straightforward about, you know, I'm talking to you for X reason. So I think it's more about kind of practicing your soft skills and, you know, having authentic discussions with people. But Jackie, what are your thoughts on it?
Yeah, I totally agree. I think I never saw that. I didn't see the value of networking at first. I thought it was like something that was kind of like fake and artificial and just something you do if you want to like get a job or, you know. So I was really, I guess I was like really, I didn't engage so much just because I did see it as more of this artificial conversation. But genuine, authentic networking is real. So, and that I finally realized when I started my preventive medicine fellowship. We got a lot of independence to basically choose our own projects, you know, make our own way and whatever we were passionate about. And for me, it was largely trauma-informed care. And so I just had to like meet everyone in the city that was doing work in trauma-informed care and get to know them. And then it wasn't always that I wanted something. A lot of times I was like, hey, I'm a fellow. I have time to offer to a project if you want me to work on it. So that, and then so from there, that really started, you know, I realized, oh, wow, I should have been doing this the whole time. I would have like, you know, learned earlier on that, you know, different things that maybe I wanted to shift my career towards. So now I like continuing to this day, I just really love meeting different people in public health. Like we've been talking about, you know, really you need to work multidisciplinary amongst many skill sets because, you know, except for maybe one or two people, you know, no one's going to be having expertise in every different area that like public health requires. And so it's just, and public health really is like, especially at the health department level, really just like bringing silos together, bringing people together. So like I hadn't met Paige before this call, but the health department worked very closely with Oak Street Health at the beginning of COVID vaccination and was a big partner in that. So yeah, I can't like emphasize enough the importance of it, but totally agree. It can be genuine and it should be genuine. It should be authentic. And when you are talking to people about things you are passionate about, I think that's when it is genuine and authentic.
Thank you so much for those advice. Glad to have you back, Perry. We'll pass it off to Cassie to ask the question the students have posed.
Great. Thanks so much, Charlotte. And I'll remove your spotlight for now. Great job moderating. And of course, alumni, thank you for all your great insights. It's been great so far. And as we get started with student questions, I'll encourage students to send in your questions to me privately if you want me to ask them, or you can send them into the public chat and I'll call on you to turn on your audio and ask your question yourself. And to get started, I know everyone here has advanced degrees. I am curious if folks can share, would you recommend working after undergrad and then going back to school, going straight through? Are there any recommendations on how to pursue those further degrees? And maybe we can start with Jackie and work our way around.
Yeah, I think it's definitely tricky, you know, to expect, you know, in your, you know, when you're so young to know like what you want to do. And, you know, like, so I guess like if you're feeling unsure, that's when exploring a little bit more is potentially helpful. I definitely had a few people in my medical school class drop out of medical school, and that of course was like a lot of money to do, you know, only 1 or 2 years of medical school. But so having like, especially I think for medical school, since it's such an investment financially and like in time, in terms of time, I think like getting clinical experiences are very helpful to really kind of inform if that is something you truly want to do. So that, I guess that's my one recommendation, is just kind of being sure about medical school. So like Tej talked about, like maybe getting other different experiences and not maybe being like, this is what I want to do, because I've met a few people now that like that's what they did and then you know, totally pivoted, but it took them a while, and you know, of course they, you know, had to invest a lot financially and time wise before they were able to find their way into what they really wanted to do. So that's, I guess, my advice there.
Yeah, that's really helpful. And Tej, I know you had to go through that decision of med school and then later going to grad school for public health. What's your perspective?
Yeah, I think that, I think it's, first of all, a really personal decision, right? Of like what your financial situation is and kind of what you're looking to achieve. I think, you know, for me, it was because I had this global health minor and experience that I felt like I really wanted an MPH because I wanted to be more of an expert on health policy and management. I think ultimately, like, the unfortunate reality is that a lot of employers recruit from grad programs. Like if you feel like you want to work in healthcare, there's probably a way to get recruited out of undergrad too. I think because I was so focused on pre-med in college and didn't have like the right internship experiences or kind of classroom experiences either, I wasn't going to be a candidate to like get the job that I wanted in a non-medical job right out of undergrad. So I think it kind of depends on your personal situation of like what you're prepared to do right out of school. Yeah, I think I agree with Jackie's point though. I think the decision around medical school is like a big one that's a little bit different that I think is important to figure out, because I think the physicians that I've met who had other experiences sort of between, or whether it's between their third and fourth year or whatever, like getting a little bit more exposure outside of like just medicine, I think helps people be better physicians. And so I think in general, I would err on the side of like diversify your experiences earlier, and that then you have more inputs to make a more informed decision about what path makes sense before you make any like big investments of time, energy, money, etc.
Yeah, that's really helpful, Tej. Thank you for your perspective from your experiences. And I appreciate that it's a personal decision, absolutely. And Perry, what about you? What's your perspective on taking time off or going straight?
Yeah, so I graduated 2011, took a year to work in New York, and then went back to grad school in 2012. So I was definitely in the younger cohort in grad school, and there was a lot of age diversity, which I think is really wonderful. My program was healthcare policy and management as well, but it was actually half in the School of Public Health and half in Yale's business school. And so I was surrounded by a lot of former management consultants, investment bankers, folks in their late 20s, early 30s who were in a different stage in their life. And it was very clear to me that I lacked some of the professional experiences that would sort of allow me to be more focused or honed in on my goals within the grad program. I had a great time. I highly recommend the grad program I was a part of, but I think 23-year-old me had different focuses than current or even like late 20s me. so that I think it would have been valuable regardless of age, but public health, because it's such a diverse field, you can kind of focus in on one disease vertical. You can sort of work across health systems. You can be in philanthropy. You could be in the for-profit. Like there's so many different ways to be engaged in public health that having more an understanding of the public health ecosystem, the opportunities to fit in, contribute, and what that might look like from a day-to-day work and satisfaction perspective, I think I could have been smarter than I was at 23. That's not to say that, but that said, the program that I was in did launch me to, and it did open doors for the career steps and opportunities that I was more interested in. And I did get to have a flavor and sort of get to sample that within grad school. So it's both and. There's no wrong time to go to grad school. But I think being strategic about what you want to get out of it and what you're trying to use it towards is for the longer term without, 5-year plans are nice, but like unrealistic. So give yourself the flexibility, but have some general vision.
I just want to add to that. I totally agree. I feel like, especially like masters in public health, I feel like it's so useful for everyone. Like that's not something, I would encourage everyone to get their MPH no matter what they're doing, but and totally agree. Like I think if I got my MPH early on versus when I did it, so I was more like a later end, and so I was very focused on like what I wanted to do and what I wanted to know, so I liked that. But certainly I would have had benefits from doing it earlier and being more exposed to public health earlier. So there's benefits and of both.
And I think all of your path can be like winding, right? Like it's not like your fate is sealed based on like a single decision, right? So like I think one of the things that I've thought about is like if I wasn't planning on going to med school, maybe I would have worked right after undergrad and then got into business school instead of getting my MPH and done an MBA focused on healthcare. And I think there are folks that I work with who've done that, and we're in like a very similar position that like our path was kind of flipped and you can still end up doing the same work. So I think it kind of comes back to like what experience you want to have, what your situation is, and like you can get to the same endpoint even by taking a different path. So I agree, Perry, everything what you said. So
great, thanks everyone. This is really great and helpful perspectives. And great. We have a question from Ron. I hope I'm pronouncing that correctly, but if you want to turn your mic on, you can ask your question about your concentration.
Yeah, awesome. Thank you so much. Everyone here that's been talking. It's been really like helpful and insightful. So my name is Rowan. I'm currently a senior studying neuro and global health. And I actually am doing the BA MPH program right now. So I started some of the MPH classes and they've been really insightful. So I applied to the BA MPH program junior year, and then because I kind of like, I was pre-med, and I've always kind of I did some global health research, and that really, I guess, like motivated me to apply to the MPH program. And I guess like my path is kind of like similar to Tej. So I did actually like an internship this past summer. It was like a pre-med internship. I was in clinic. I was in the OR, and I did realize a lot of things that like definitely did need help like structurally. So I started my MPH classes this past quarter, and I'm doing them this quarter, and I've like learned so much through them. So like I officially kind of am gonna go through the public health route, and there's different concentrations that are through the MPH program. I know a lot of you guys talked about that you're doing like health policy. You guys did health policy / administrative policy concentration, but the Northwestern program offers like a generalist track concentration. There's a community health research concentration, epidemiology, and then global health concentration. So I wanted to ask what advice would you guys give on the best concentration to use if I'm interested in more health systems, like structural healthcare management?
Perry, do you have any?
Yeah.
You go first.
I think I mean, I'm a good example of, I was a health policy and management person who did a global health concentration in grad school as well. And I will say that my professors weren't quite sure what to do with the combination of health policy and management and global health. So that program was much more US focused. So I hopefully things are shifting to a more broad sense, but US health policy is its own complex world. And so that is a little bit how that's focused. Maybe it looks different for Northwestern. But that said, I think public health is really good about giving you the basic skill set. I was healthcare policy management, but now I'm working in infectious disease and epidemiology. And I took just the baseline epi courses, and now like I'm deep in it. So yes, be intentional about what you're interested in, where you want to go, but also recognize that that skill set is applicable kind of across disease areas, across different verticals within public health generally. And so do what you're interested in, what you're motivated by, but also keep an eye on sort of those core functions that you can apply anywhere else across the public health sector. So that's what I would say.
Yeah, I agree with that. And I think the other thing it comes back to here is also like the value of networking, what internship experiences you get, how you frame things on your resume too is also really important. So I think like do what you're interested in or what you think will get you the experiences and skills that you want, but realize, you know, to Perry's point that like these skills are broadly applicable to like different areas. And it's just a matter of how you present them and apply them and frame them versus like a concentration or a degree necessarily dictating exactly where you're going to end up, at least from a public health standpoint. So yeah, those are my 2 cents.
Yeah, I totally agree. I don't think the concentration affects things as much as like your experiences do both during grad school and after. I personally did the generalist at Northwestern just because then I had the flexibility of deciding which electives I wanted to do.
Thank you so much. Appreciate that.
Yeah, thanks, Ron. And thank you to our alumni speakers. We are running up to the hour together, so we will close out here shortly. But thank you so much to our alumni for sharing so many great insights with our students today, answering their questions and whatnot. We really appreciate you all taking the time to be here. And of course, thank you to our students who were logging in. Students, do keep an eye out for a $20 Grubhub credit from us. We normally purchase lunches when we host these events, and we can't do that virtually, but we're going to send you a Grubhub gift card so you can do it yourself in the next 2 weeks. So keep an eye out for an email from me with that information, and also our alumni LinkedIn profiles so that you all can connect and start building your network while you're in school. We hope you all have a great rest of your day, and go Cats.